Everybody. I'm Sunil Amrith, the Interim Director of the Mahindra Humanities Center at Harvard. And for our first virtual seminar in the lockdown, I'm especially pleased to have with me in conversation the three chairs of our seminar on Critical Health Humanities, which launched this year. Sari Altschuler is Associate Professor of English at Northeastern, Associate Director of their Humanities Center, and Founding Director of the Health, Humanities and Society minor at Northeastern University. Amy Boesky is Professor and Chair of the English Department at Boston College, Director of their minor in Medical Humanities, Health and Culture. And David Jones is the A. Bernard Ackerman Professor of the Culture of Medicine at Harvard Medical School and in the Harvard History of Science Department. I'm grateful to Daria Lugina, the Mahindra Center's Communication and Design Coordinator, for facilitating our conversation. Welcome, Sari, Amy, and David. Thank you so much for taking the time to speak with us. Let me begin with what seems to many of us now like another era, which is last semester. And of course, you launched the Critical Health Humanities semester at the Mahindra Center, seminar at the Mahindra Center back in the fall. How did that come about? What led the three of you to come together to organize that forum?
Well, serendipitously, Amy and I got together just to talk about running health humanities, medical humanities programs, and we both expressed a desire to have a Boston area meeting and lamented the fact that there were so many people interested in the medical and health humanities in the area, but really there seemed to be no centralized location to have those kinds of conversations. So we started talking about it, and then we thought that the Mahindra Center seemed like an obvious place where people were already going to do that kind of work. So I had met David through other things that were happening at Harvard, and so we reached out to him. And I don't know, David, if you want to take it from there.
Yeah, and once I heard this suggestion from Sari and Amy, it immediately seemed like a terrific idea. As Sari had said, there's a wide and diverse community of people in the Boston area who are unfortunately separated by barriers of both geography and institution. And it seemed like it would be a valuable and interesting experiment to see if we could overcome those. And the Mahindra Center, both because of its convening power and also the support that it provides to groups like this, made it seem like an obvious place to try it. And so far, until we were aborted by the current epidemic, we were totally gratified by the response we got, both to small group discussions with faculty, and then to the first of our series of public lectures with Al and Brandt. We had several hundred people back in the day when you could do that. And so we are really hopeful that we'll be able to maintain this enthusiasm once we're able to resume operations next fall.
Fantastic. And I would just add to that the some of the excitement that's been generated in the academic programs that Sari and I have seen and David has seen in his academic work, we wanted to expand that across universities to think about the transdisciplinary approaches to health, illness, and disability that I think we're now seeing is so essential, whether it's thinking about urban design, politics, economics, the ways in which it's only through transdisciplinary lenses can we begin to even unpack what we mean by issues such as contagion, which we're all facing right now in our daily lives.
Great. I mean, there's such a sense of urgency about the current pandemic, and things are changing from hour to hour. Many of us are glued to our news feeds. It is difficult to take a step back from that. But I would love to hear from all of you about what you think we gain by stepping back, by thinking in slightly more long-term ways, drawing on medical history, drawing on the study of medicine and literature and culture. Now, how can those sorts of perspectives help us to understand what it is that we're all living through at the moment?
Yeah, I'll just say something general about history at first, and then let Sari and Amy chime in. The historians are always saying, well, history offers valuable perspective. I think this is a case where we can say that with more credibility than usual. Humans have been dealing with epidemics for as long as we have been living in cities, which is now thousands and thousands of years. And over that time period, human societies have learned ways to respond to epidemics. Some responses are more productive than others. Things like immunization or social distancing or quarantine have now become part and parcel of our daily life. And these are interventions that emerged very much from our historical experience. And then historians like other scholars, have been able to study this long record of responses to epidemics. And in doing so, we have learned a lot about how human societies respond, both for better or worse. And we can try to use that wisdom to guide our current responses.
Yeah, and just to, as somebody who studies literary, the sort of literary representations of medicine, and thinks about things also in a historical way. I mean, I think that something else that that both Amy and I are very interested in is the ways that people have narrated epidemics, and the ways in which the language that we use and the kinds of stories that we tell about epidemics really affect responses and do contribute to who lives and who dies, and where resources get allocated. And so one of the things that the humanities really can do, and that literary study or reading stories about the past can help us do, is to think about the ways in which language and narrative and plot really guide our responses in ways that we may not be completely aware of. And something else that I wanted to say about this is that I think we've even seen a kind of groundswell of interest in the arts and humanities in a more popular sense. There are all these free concerts, free museum tours. People seem really energized by the kinds of objects and tools that people in the arts and humanities use on a daily basis in a way that I think hasn't been as clear, but really sort of comes to the fore in these moments of crisis.
I mean, I would add to that, I think that one of the contagion narratives that I've taught that I find especially interesting right now is Emily St. John Mandel's Station 11, where a traveling troupe, there's actually been a global flu that has wiped out, something like 98.6% of humanity. And it's set in the future, and there's a traveling troupe that performs Shakespeare. And I think one of the things Mandel is interested in teasing out is the relationship between survival and art. And what is it that art allows, and the persistence of language and an idea of humanity that is perhaps more expansive than all the threats to humanity that are also happening at the same time. So it's interesting. I have been struck by Priscilla Wald's formulation that there are outbreaks, but there are also outbreak narratives, and they're not the same. So right now we're experiencing both. We're in the middle of an outbreak, and we're also seeing these exfoliating narratives that are coming out, narratives of courage and unity, narratives of cruelty and disparities. And I think what's especially challenging right now is we're in the midst of it. So people are trying to frame and make meaning of experiences that are so we're still in the midst and still trying to make meaning out of things as they're unfolding around us.
I just wanted to add too that, I think especially in these kinds of moments of uncertainty, moments that kind of feel unprecedented, that people are hungry for different tools for making that kind of meaning. And so I think the humanities offer a kind of expanded tool set that people don't necessarily think about when they have their preformed, disciplined ways of approaching problems that they're already familiar with.
I think that's right. I mean, we hear the word unprecedented so much at the moment, and yet I think there is a sense in which everyone is reaching for other perspectives, for longer perspectives. David, just last week you published a piece in the New England Journal of Medicine on sort of lessons for COVID-19 from history. For those in particular who haven't read that yet, what did you identify as some of the key lessons?
Well, certainly the point you were just making about this not being unprecedented is sadly true. Epidemics have been with us for a long time, and by historical standards, this isn't yet even a particularly bad one, which I somehow find strangely reassuring that it could be worse, and we're not at a total epidemic horror stage yet. Everyone fears it will get worse. I think the most striking thing you see from history is that this epidemic has a very familiar pattern of rise and fall. This has been captured in literature, with Camus' The Plague being a classic example of this, and historians and epidemiologists have written a lot about this. And there's this characteristic pattern, again, both in epidemic and also in the epidemic narratives. When a pathogen moves into a community, there start to be early signs that something is going wrong. In the plague narratives, the classic story is people see dead rats and they don't think twice about it. But eventually the rising burden of disease and death becomes irresistible, and it demands attention from the society that is being struck. One of the first things that societies try to do is they try to explain what's happening. And this often plays out at multiple registers. There's the scientific question, what is this disease? What is the pathogen? Where did it come from? But there's also a moral, social, economic, political question. Why did this happen to us now? What did we do wrong, if anything? Who can we blame for what has happened? And you see that time and time again. Once we have explanations, hopefully correct explanations, but once we have explanations, then societies can start to mount responses. And again, you see these classic historical patterns of quarantine, of isolation, the hope for a scientific solution. And then eventually we will turn the corner. Epidemics have a certain internal logic in that the pathogen eventually will run out of susceptible people in the population. We hope it's not simply a passive response like that. Hopefully some of these control measures that we're implementing will also alter the course of the epidemic. But probably the most important message from history is that all epidemics do end. The crisis will pass. Human societies will continue. We're resilient. The societies will perhaps be transformed. We don't yet know what the magnitude of the mortality or the magnitude of the insult to society will be. But we've been through horrible epidemics in the past and have always been able to get through them. Even if there is that hopeful note, there are a series of warnings that history would teach us to be careful of. Epidemics put tremendous pressures on the societies that they strike, as we're all experiencing right now. And that strain often will reveal latent fractures or tensions within society. And you see that most clearly in the desire to blame. Now, that has been in the news a lot recently with these debates, and now legislation that has been introduced about whether or not we should refer to this as the Wuhan virus or the Chinese virus. But this is not unprecedented at all. You could see these blame narratives with gay men and AIDS in the 1980s, going all the way back to the persecution of Jewish populations with the plague epidemics in medieval Europe. Well, this desire to blame is predictable and understandable in some ways. It simply isn't productive. And the social responses will work much better if societies come together and find mechanisms of collective action where we're united in our response to this. Another one of the warnings that history would suggest, and these are the words of my colleague Alan Brandt, there is no magic bullet. There are many people who hope that a vaccine will soon come and deliver us from this evil. And that is a good thing to hope for, and there's a chance that that will happen. But these hopes often have not turned out as we wanted in the past. We're now 40 years into the AIDS epidemic, and we still don't have the vaccine to AIDS. It took many, many years to develop the vaccine that we now have against Ebola. And there have been many cases, even when we do have effective technologies, where a whole series of social factors limit the optimal deployment of those technologies. So that even when we have a good technology, we don't necessarily have we don't enjoy the full benefit that that technology could provide. The medical devices, the medical techniques, the vaccines we develop will only be as good as the social, political, and economic systems we put in place to deliver those technologies.
Thank you, David. I mean, I think that those are very stimulating things to think with. One point you end your piece on is the sense that another lesson from history is, that as much of a sort of danger as epidemics pose, there's also a danger of sort of exaggerated fears and overreactions of different kinds. I wondered if you'd say a little bit about that.
Yeah, I have a bit of remorse about some of those comments now, that I've seen the ways in which that argument has become deeply politicized in this country. When I heard Trump at one of his press conferences this week suggesting that maybe we were overreacting, I had the sickening fear that someone on his staff had read my piece and was now feeding him this line. I hope that's not what happened. But it is a really difficult problem. We are now in the situation in Massachusetts where we've been relatively lucky. There are roughly 20 deaths so far, most over the past week. That number will grow, but that's still a relatively small number. compared to the thousands of people who die each year from flu or thousands of people who die from heart attacks. You can look at a country like China, where the total mortality from COVID is under 5,000 deaths. They have 5,000 deaths a day from heart disease at baseline. And so in the total patterns of global mortality, COVID is still a relatively small player, and yet it has precipitated unprecedented social and economic change. They just announced this morning that in the last week alone, there were 3.2 million people who had filed for unemployment. Work by our colleagues at the Harvard School of Public Health have shown that poverty, unemployment, those sorts of social stressors are toxic and will likely kill measurable numbers of people in response to this economic disruption. And so this question of how we figure out what level of response is appropriate is one of the most difficult scientific and political questions that we face right now. I'm still of the thinking that there is so much uncertainty, there's so much that we don't know, that precaution likely is the better part of valor. And if there is anything that we can do that we can tolerate that might slow this epidemic, that's likely wise. But as we do so, we need to be actively paying attention to what the unintended consequences of these policies are, because it's the people who are the most marginalized, the most powerless, the least visible, who are going to bear the brunt of these costs. And unless we're actively looking, we're going to miss the harm that we're doing.
Sure. Sari, one of your responses to this has been to, you initiated with a colleague this crowdsourced coronavirus syllabus, and it's something that I've already used in teaching this week, and it's really taken off. It's really resonated. How did that come about?
So bizarrely, I was actually in Paris doing some work as an invited professor, and I was precipitously drawn back because of the flight ban. And while I was 35,000 feet in the air, my colleague wrote and said, you and I have done some work on this in the past. Her name is Elizabeth Dillon, and she and I had initially kind of drafted some of the language for the Health Humanities and Society minor. And she said, I think that if we work together on this, it could be something that's really useful for people. And there had been some other efforts that were happening kind of at the same, pretty much at the same moment. Alondra Nelson also put together a syllabus that's really wonderful. And there's an anthropology syllabus that's circulating as well. But one of the things that we thought was that these syllabi were really focused on the natural and social sciences as opposed to the humanities. And while I can understand the imperative to think about natural and social sciences as a resource for thinking about the pandemic, we thought that first of all, that there are a lot of professors in the humanities who suddenly, as you were suggesting, needed to change their syllabi really rapidly and could really use a set of resources. But also that more broadly, if we could put together something that was a kind of available toolkit for people to begin to make sense of things, that would be really useful. And I think that's really the impetus behind it. We also, with some disciplinary humility, understood that two professors in English departments, or in a single English department, wouldn't necessarily have access to all of the materials that might be useful. So that's the reason why a crowdsourced syllabus. And here we were thinking about other kinds of crowdsourced syllabi that had been really effective, like Black Lives Matter. At various moments, there have been these kinds of online crowdsourced syllabi that have been extremely useful for people trying to make sense of problems as they emerge. So that was the kind of impetus behind it. And I was about to say, because we come from one disciplinary home, we really wanted to make sure that there were other disciplinary homes represented. So I guess I will actually say, if there are philosophers who would like to contribute more, we would really love that. That is really a kind of, I think we only got 2 entries as suggestions, and I understand that that's not our area of expertise, so I could go digging, but if there are philosophers who would like to contribute, we would love that. We also asked for religious studies folks to contribute, art historians, and we wanted a combination of both primary and secondary sources, so that if people really wanted to think about primary sources to teach with, they could have that, but also if they wanted to dig more into the kinds of explanations that scholars had given to think about both pandemics and epidemics in the past, and also our present crisis. We also wanted to provide that. So it's been wonderful. There are about 100 people using it at any given time, which is great to see. And it's just been, I feel just a little guilty that we didn't do a better job of recording all of the people who made contributions. But publicly, I just want to say thank you. Obviously, we didn't we didn't necessarily think everything through when we started, but it's been wonderful to have this like truly crowdsourced effort. So yeah.
I think it's a model of the kinds of collaboration that are possible in this moment. And I know many of us are very grateful to you for putting this together. And it's also, in some sense, that syllabus is like a snapshot of a lot of the different kinds of work that have been going on across the humanities in the field of health and medicine and disability. And that itself, I think, is very meaningful and useful. And after this crisis has passed, I hope people will continue to build on this.
Well, thanks. I just wanted to say as well that the syllabus is really motivated by the same kind of effort as the seminar that the three of us run together. Really a desire to bring together people from humanities disciplines and from the healthcare professions that don't necessarily talk as much as they should.
Yeah. Amy, a lot of your work has been, this came up earlier in our conversation, about narrative and medicine. And I mean, is there a sense, as you observe the narratives that we are collectively starting to sort of devise about the current crisis, is there a sense of familiarity about them? Are there things that seem novel to you, the things that are surprising? How have you thought about the ways in which we are telling stories about the coronavirus pandemic?
It's striking to me thinking about the crowdsource and the word crowd, and thinking about one of the tensions for us and why I think this pandemic is, and David, just to kind of, in a way, juxtapose what I'm going to say with what you're saying, that there is something, I think, quite extraordinary in this moment, is the sense of the role of the individual and the role of the crowd, the mass, the group, the globe, however we're imagining it. And we think of ourselves, I mean, at the root of the word contagion, tagare, to touch, we think of ourselves as touching each other's lives, and yet now distanced. And that paradox, I think, in a highly digital age, and in a moment. So I'm going to answer your question, because I'm thinking that I was trained as an early modernist, and I begin in my courses on contagion narratives. We begin with Defoe, Journal of a Plague Year, where HF, who's a journalist, has a kind of compulsion to record. He moves through, I mean, London really becomes the central character of that narrative. And as he tallies through the bills of mortality, the dead, he tells these individual stories of randomness, of wealthy men who die hoarding their goods, and poor people who survive, of struggle, of the stripping away of human ritual, which we've been hearing about in Italy and in Spain, which is so heartbreaking when people die alone and can't commemorate the dead or have funerals. I find there is a work of defamiliarization that happens in literature that is part of what is important about it, that it shocks us into seeing anew the pain, the struggle, the unknown, the ineffable. And I think, for instance, when I teach the plague, so it's very interesting to hear David's reading of it, one of the things that students grapple with is the idea of literary character, and what Camus is trying to do as he thinks about, so another journalist, Rambert, who is struggling with the idea of what does it mean to belong? What does it mean to be from somewhere? Which many of us are now having to think anew. Where did we end up? Sari was in Paris. 3.5 weeks ago, I was in Rwanda. What does it mean to be able to travel and to not? I think plague narratives grapple with these questions differently depending on their moment in time, the kinds of historical situations that they're confronted with. But there are common threads, and I think the common threads have to do with confronting that tension between the individual and the group. These are stories not about, I mean, in much of my work in medical humanities is about individual narratives that are recounting the story of one person. Plague narratives are not that. They're looking at crowds and groups and larger states. But they invite us, I think, to ask questions. And I would sort of say one of the most important aspects is the question of meaning making at the end, which is, what do we do with this? At the end of the plague, there's that sort of that shadow of people coming back out into their lives and cautiously forgetting as the plague recedes, and Camus' stark reminder that the plague will come again. You know, so we have to make something of this, but the question is how to do so cautiously and without jumping to the kind of meaning making that, as David said so rightly, becomes either stigmatizing or pejorative or narrowing. Or so I think we're in the midst. This is, we're in a narrative and not outside of a narrative, and we who study literature want to be able to make meaning and compare meanings, but we're not there yet. We're just we're in the early days.
David, just a sort of speculative question. I mean, what sorts of materials do you think future historians will have to study this pandemic? I mean, you know, as historians, we sort of, there was a piece in the Boston Globe encouraging us all to keep diaries for future historians. I mean, do you have much of a sense, I mean, even just sort of speculating about, you know, what sort of trace this is going to leave?
I think it will be a wonderful but impossible opportunity for future scholars. Historians of the present, I think, often mistakenly have romantic notions about how great it would be to be an early modernist like Amy, where there are a finite number of sources and you can read everything and claim to have expertise. I was recently reading a book in the seminar with you about air pollution in London in the 17th century, where the historian mentioned in passing that there were tens of thousands of court cases from London in the 17th century in Latin that no one had ever read. And so this notion that early modernists have it easy, I think is a myth that we tell ourselves. But certainly, I think this will be unprecedented, in part because it's been so far-reaching globally. There's an enormous record being produced in nearly every country worldwide now. Because societies where the epidemic has been a problem have largely shut themselves down, everyone's attention is focused on this. And so now, like, you can't even read if you look at the sports page of the newspapers, that's all about COVID as well. So I think every domain of human output, journalistic output, artistic output, is being captured by this epidemic. And this is the struggle for all recent history. Because of online media and social media, everyone is able to produce a durable artifact. There are millions of blogs being produced. There are commentaries. Anything that gets published gets then commentaries about that. There are working groups. There are these artifacts like Sari has produced, the syllabus. And you could imagine analyzing that. Like, at this moment in the second week of the epidemic, what was it that were on people's minds? What were their associations? What were their hopes and fears? And so I think anyone who wants to study this will be drowning in material, which is both a wonderful opportunity, but also a curse, because no one will be able to claim to have the authoritative voice on this. I think this will be an opportunity for incredibly diverse responses, which will be chaotic, but I think that will capture, in some ways, the sense that the epidemic itself is chaotic. And it'll be a reminder to us that our powers to rationalize can only get you so far in the setting of such a fracturing event like this pandemic.
Assuming, sorry, did you want to come in there?
Oh yeah, I was just wondering, I mean, it sounds in part like also, you know, some of the tools that might be most useful are things like digital humanities, digital history tools. Is that, you know, is that a way that you would recommend going? I know that there's some anxiety on the part of literary scholars about practices like distant reading, where you take a whole corpus of material and you say, you know, how many times does this word appear, and how can we analyze things from that perspective? But would you say that, for example, like a kind of big data approach to Twitter might be a way of thinking about it? I'm just trying to think about, in answer to your question, different kinds of digital tools that might be useful.
I think we'll have to try everything possible. Even, a historian 5 years from now saying, okay, I'm going to read all of the New York Times coverage. That would probably be a tractable problem, but a difficult one, because I'm sure it'll be hundreds, if not thousands of articles by the time it's done. But if you wanted to say, how did US media capture this epidemic? And what could you possibly do other than those tools of digital media? There are dozens and dozens of venues producing dozens and dozens of articles a day. And that's just the print and online media, trying to capture, what's going on between CNN and Fox News and One America Network and all these other venues, MSNBC, that are churning out commentaries, talking heads, all this other information. How will we capture this? How will we wade through this to figure out, to what extent does any of this reveal what really mattered to us or what was important to us? What best captures the experience of people in a meaningful way? And those experiences vary so enormously. The experiences of people, I feel relatively or extremely fortunate as a university professor not to have been laid off, to have a work life that can be converted to online work relatively easily, to have a backyard where I can blow off some steam in this new era of social isolation. My experience is radically different from my colleagues at the medical school who have now left their oncology practices and are now staffing the COVID units that are waiting for the patients to come in, let alone the experience of people who run museums or restaurant workers or first responders in various ways, who now every time they get called to a fire are worried not just about the fire, but the people they pull out of this building, will they be infected by them? Trying to capture that diversity of experience is an incredibly daunting challenge.
So just a word about that, because I'm going to go back to Defoe. So the Journal of the Plague Year, I think, is partly about that, David. It's really interesting that what you're describing is the ineffability. How can you capture becomes one of the themes of plague narratives. And HF, who is, and Defoe was a journalist and best known for writing Robinson Crusoe, but probably Journal of the Plague Year, which is historical fiction. It's set in 1666. It was probably based loosely on the diaries of his uncle, Henry Defoe. But part of what happens in the narrative is it becomes a compendium of all the smaller forms. The bills of mortality, the 17th century equivalent of blogs, various kinds of panorama around the city, little anecdotes of different people. And I think what Defoe was trying to capture was exactly what you're describing, which is how can you describe a world coming apart? And we're seeing that around us. And literature is just one place in the arts. It reminds me again of what we began with, which is why the value of the transdisciplinary at a moment like this, which is what an economist can show, what a urban anthropologist can reveal, what, each of these fields will show us some of that fracturing and the incommensurate. How do you describe becomes, I think, part of the task of what we're all feeling. Some of us have been referring to what we call the other calendar, which is the life we're supposed to have been living today. The canceled plans, the talks, the trips, the weddings, the events that are gone. Some of us have been talking about an experience as if we're traveling in a country foreign to us. We're getting through the day, figuring out how you get groceries, how you wipe groceries down, how this becomes the work of the day instead of our ordinary work. All of this, I think, is part of what literature has tried to capture and can reveal. But you're totally right. This is it feels to me like a whole fractured world that is out there. And to be able to pick up all of those pieces, I think would defeat the purpose, because it's the pieces that are part of what we're experiencing.
I just wanted, if I could, just to pick up a little bit on what you're saying. I think that that's one of the things that as literary scholars, we I think we do in a way that's maybe a little bit different from other disciplines. So just thinking about the kind of contributions that different disciplines make, one thing that I think we're pretty good at is thinking about people as not necessarily rational actors, and thinking about, what people do at moments of uncertainty where they're guided by things that are not necessarily predictable. And so at these moments that feel incredibly uncertain, I think that there's a little bit more, I'm not saying necessarily than other disciplines, but we just maybe do it differently, a little bit differently. Think a little bit more about the ways in which people process things, and don't necessarily expect that there's a good reason that we can then cling to for why it is that people are behaving in the ways that they're behaving. And one thing that strikes me, has long struck me about feels like public health, is that they have this relationship to emotion that's a little bit bizarre. And I think that this is a moment where maybe the humanities can offer some tools. For example, right, you want people to be a little bit afraid of things so that they behave in the appropriate way, but you don't want them to be so afraid that it's detrimental to their health, that they do things that are actually, publicly detrimental. And so negotiating that kind of balance, I actually think is trickier in fields where thinking about emotion and actions and thought processes that are not 100% based in reason. I think that's actually something that people in the humanities think a little bit more about than, for example, a lot of people in public health or economists or other kinds of fields that are so indebted to a particular kind of empiricism. And so, so I do actually think that that's one thing that that thinking a little bit more about narrative and about tools of literary analysis can actually offer.
Well, that I want to thank you all for such a stimulating conversation, and for joining me when I know we've all got a lot of uncertainty and a lot going on. I'm really grateful to you all, and I wish you very good luck next semester when hopefully the seminar can convene again as normal. Thank you very much, Sari and David.